Okay, so we've got some really interesting listener sources here, all about extended bottle feeding.
Mm-hmm.
You know, specifically what happens when kids kind of keep using the bottle past age 2.
Yeah.
And I think what we want to do today is sort of cut through all the noise and really pull out those key takeaways that everybody needs to know about this practice. Maybe even uncover some surprising connections.
Absolutely.
That maybe you hadn't thought about.
Yeah.
Because I think we all kind of get it, the convenience of a bottle for babies.
Sure.
But what these sources are kind of hinting at is that if we hang on to them for too long, there might be some unexpected downsides for growing toddlers.
Absolutely. And I think what's so fascinating here is how something that is such a helpful tool in infancy can kind of almost subtly shift the developmental trajectory if its use becomes prolonged.
Right.
And so it really prompts us to consider the broader implications for, their overall health and well-being as they move into toddlerhood.
Okay, so let's dive right in and talk about some of those physical health aspects.
Yeah.
One thing that really jumped out at me was the increased risk of obesity.
Right.
And I think it makes sense when you think about, how easy those liquid calories from milk or juice can kind of be guzzled down from a bottle.
Yes.
And potentially override the body's natural fullness signals.
That's right. And, it's not just the calories themselves, but it's really how this might be impacting their appetite for solid foods,
right,
which are so vital for fiber and just that, full spectrum of nutrients. The research even pointed to a statistic suggesting that for every additional month of bottle use between the ages of 3 and 5, there's about a 3% higher chance of being in a higher BMI group.
Oh, wow, that's significant.
So that's a trend there.
Yeah, and it's not just, the weight gain. There's also the potential for nutritional deficiencies.
Yeah.
Particularly iron.
Exactly. Excessive cow's milk from a bottle can become a real factor here.
Okay.
It can reduce their intake of iron-rich foods.
Right.
And cow's milk itself isn't actually a great source of iron.
Right.
And it can even hinder iron absorption.
Oh, wow.
There's even some evidence suggesting that it might cause minor intestinal irritation in some kids.
Oh, really?
Which can actually lead to iron loss.
Wow.
And, thinking about how crucial iron is for energy levels, for growth, for brain development, this becomes a serious concern, especially in that 2 to 4 year age range.
So it's almost like this reliance on the bottle is kind of displacing the opportunity for a more varied and potentially iron-rich diet.
Yeah.
And then that's having this sort of knock-on effect on their overall health.
Precisely.
And it's not just internal, right? Because there's also the increased risk of ear infections.
And what's interesting here is the simple physics of it.
Okay.
So when a child drinks from a bottle lying down, fluid can easily back up into the eustachian tubes.
Okay.
And in young children, these tubes are actually shorter and more horizontal.
Interesting.
Making them even more susceptible to that fluid buildup.
Okay.
And that fluid can create this environment where bacteria can grow and thrive, leading to those middle ear infections.
Makes sense.
Yeah.
Okay, so let's shift gears a little bit and talk about the mental and emotional development side of things. One point that really caught my eye was this potential impact on attachment and bonding.
This raises such an interesting point about the nature of feeding. While bottle feeding can certainly involve closeness and bonding, the sources kind of contrasted this with breastfeeding, which typically involves even more consistent, intimate physical contact. So prolonged bottle feeding, particularly if the child is holding the bottle independently, might offer fewer of those opportunities for sustained eye contact. And that nonverbal communication.
And then it sounds like, that reliance on the bottle could also play a role in their developing self-soothing skills.
That's a key consideration because if the bottle becomes that go-to source of comfort, it might kind of inadvertently delay a child's ability to develop those independent ways of managing their emotions and calming down, which is such a crucial developmental step. And this can also be linked to sleep patterns, where nighttime bottles can create this strong association between feeding and sleep, and that can disrupt those natural sleep cycles.
Which could then contribute to some of the behavioral challenges that we see sometimes around weaning. The frustration, the tantrums. It's almost like taking away a security blanket in a way.
Precisely. The bottle can become such an emotional anchor.
Yeah.
And so attempts to wean can trigger some really strong reactions. Yeah. There's also just the practical aspect of delayed independence, like not transitioning to drinking from a cup as readily.
Right.
And, those fine motor skills and hand-eye coordination needed for cup use, those develop with practice.
Yeah, and of course we can't ignore the dental health consequences.
Right.
Baby bottle tooth decay seems like a huge concern.
Absolutely. The repeated exposure of their teeth to the sugars in milk formula or juice from a bottle is a primary cause of early childhood caries.
Yeah.
So the bacteria in the mouth thrive on these sugars, producing acids that actually erode the tooth enamel.
Wow.
And nighttime bottle feeding is particularly risky because saliva production decreases during sleep, allowing those sugary liquids to just sit on the teeth for longer.
And it's not just decay, right? There's also potential issues with teeth alignment.
Yes, that prolonged sucking motion can actually exert unusual forces on the developing jaw and teeth.
Wow.
Potentially leading to malocclusion issues like open bite or overbite.
Okay.
Artificial nipples engage the oral muscles differently than breastfeeding.
Right.
Which can also influence the alignment of the dental arches.
So given all of this, what do the experts actually recommend?
Right.
We've got the American Academy of Pediatrics and the World Health Organization, both mentioned in the sources.
So the AAP recommends introducing a cup around 6 months.
Okay.
And completing the transition from bottle to cup between 12 and 18 months.
Okay.
Ideally by 15 months.
Got it.
And they emphasize the risks that we've been talking about, the dental problems, nutritional issues.
Right.
They also strongly advise against putting a child to bed with anything other than water in a bottle.
Okay.
Because of that tooth decay risk.
Makes sense. And what about the WHO?
So the WHO recommends exclusive breastfeeding for the first 6 months.
Okay.
Followed by complementary foods and continued breastfeeding up to 2 years or beyond.
Okay.
So while they don't really specify a strict timeline for bottle weaning,
right,
their emphasis on transitioning to family foods by the first year naturally supports a move away from bottles as children develop those broader feeding skills.
So the core message here really seems to be that while bottles have their place early on, extending their use beyond toddlerhood, really carries some significant risks for their physical, mental, and dental well-being. The AAP's guidance to wean between 12 and 18 months seems like a key takeaway here.
Absolutely.
For mitigating those potential issues.
It really is.
Gives you a lot to think about.
It does. And it kind of makes you wonder, given that comfort and familiarity that so many children associate with bottle feeding.
Right.
What are some more, innovative, gentle approaches that parents could explore to help their little ones transition smoothly, drinking from a cup? It's such a common challenge.
Yeah.
And I think finding creative solutions could really make a difference.
Absolutely. All right. Thanks for joining me on this deep dive.
My pleasure.
Until next time.
See ya.